My bad, Marianne Mahayusuf. Before I enter the patient's room, I sanitize my hands. Use clean gloves. And then I'm gonna be cleaning my stethoscope with Lysol wipes. Once I have that done, when I get to the patient's room, I check for the safety hazards. There is no hazards, everything is good and safe. I'm gonna start with the introduction. Mr. Overton, my name is Marianne Yusuf. I'm a student nurse. I'll be doing a head-to-toe assessment on you today regarding your fall a couple of days ago. Is that okay?
Yes.
Amazing. Before I start, would you like to use the washroom?
Okay.
Is there any discomfort or pain? Oh, perfect. I'm going to be closing the door and the curtains for privacy. Can you please verify your name and how old you are for me?
Mr. Overton, 92 years old.
Amazing. Thank you so much. And the first expression of Mr. Overton, taking a look at him, he stated that he's 92 years old and he looks like he's 92 years old, so that matches what he says. The skin tone matches his ethnicity and there is no unusual odor. The next part we'll be checking is, I'm just going to get you to stand up for me. Thank you very much. The height and the weight is proportionate. The posture is erect. The body is symmetrical and there's no deformities. I'm going to have you to have a seat. Thank you so much. The next part I'm going to be checking is his facial expressions. He seems very calm, very relaxed. The mood is good. He is very well spoken. He's well dressed for the weather. He's well groomed and there's no signs of malnutrition. And yeah, he's making great eye contacts as well. The next part I will be looking at is his respiration. It seems normal. Okay, there is no distress, no accessory muscles used to force the breathing. That's why it looks all symmetrical and normal. And the last part for the general survey, I'll be checking his level of consciousness. So Mr. Overton, can you tell me where you're at, what time and what date it is?
Yeah, it's Wednesday, 2:30 p.m. and I'm at the hospital.
Perfect. He's oriented. We got all the 3 points. He's well aware of what's going on and he answered all the questions correctly. On top of that, he verified his name and his age as well. Moving to the next part is his face. It's symmetrical. There's no signs of lesions, scars, masses. The skin tone matches the rest of the body. There's no deformities and there's no involuntary muscle movements. Now we're gonna be checking the cranial nerve number 7. I want you to smile for me. I want you to show me your teeth. Frown for me, please. Lift your eyebrows and close your eyes now for me. Try to resist me. I'm gonna try to open your eyes at a time. Amazing. Puff your cheeks. Resist. Amazing. Everything seems symmetrical and normal when it comes to that. The next one is the eyes. Taking a look at the eyebrows, the lashes, the eyes, they're all symmetrical. The shape of the eyes is round. He has a beautiful shape. And looking at the sclera is white and the lash distribution is equal for both eyes. I'm gonna be just checking your conjunctiva. Perfect. It's moist and pink. There is no lid lag. There's no crusting, there is no discharge, there is no abnormal blood vessel findings here. And now we're gonna be doing the cranial nerve number 3, checking basically, we already checked the eye, the part of it. Now we're gonna check for the pupil size. I'm gonna start off with that. Okay, look at me. The pupil size is 3 millimeters from both sides. It's round. We're gonna be checking the reflexes now, okay? We're doing the direct, amazing. And then I'm gonna be checking the other eye while putting the light on the other one. Okay, so direct is consensual. Now the next part we're looking at, I want you to look at my pen, keep looking. That's the accommodation, so it's we had the converge, so everything seems good and normal. The next part we're going to be moving to is the ears. The ears, taking a look at Mr. Overton, they're bilateral, they're symmetrical. The skin matches the rest of the skin color. There is no discharge. There is no excessive sternum. Are you feeling any pain when I'm pinching your ears? No. And there's no tenderness either. And the temperature matches the rest of the skin. The next part I'm looking at is his nose. The nose is midline, symmetrical. There is no discharge, there is no lesions, and there is no scars either. We're gonna check the nasal passages for the patency. I'm gonna close one side, breathe, and the other side. Amazing. So there's patency for the nasal passages and symmetrical. The next part will be the mouth. The mouth is symmetrical. The color is pink. There is no lesions. There is no scars, and it's moist. Okay. Now we're gonna be testing a cranial nerve number 9 and 10. I want you to say ah. Perfect. The uval and the soft palpate are resting symmetrically. And then now the next one is and then I want you to say type. No, I want you. Sorry, we did the ah. Okay. And the next one is cranial nerve number 12. I want you to stick out your tongue, side to side. Perfect. The tongue is midline, is side to side. And I forgot to ask you symmetrical. And I forgot to ask you to tell me the light, tight, dynamite.
Light, tight, dynamite.
Perfect. There's no murmurs there. Okay. The next part we will be taking a look at is the neck. Okay. The neck looks symmetrical. The skin color matches the rest of the skin. There is no scars. There is no lesions. There is no masses. I'm gonna also be palpating. So can I touch your neck? Thank you. Feeling the trachea is midline, symmetrical, and then there is no thyroid enlargement. And the temperature is the same as the rest of the body. Okay, now I'm gonna be doing the carotid artery palpation. It's 3 points. I'm gonna be doing each side at a time. Perfect. Amazing. We're gonna do this side. The rhythm is regular, is strong, +2, and then it's the same both sides. Okay? Now we're gonna do, the last one we're gonna do is the cranial nerve number 11. I'm gonna ask you to shrug your shoulders for me, please, and resist. Amazing. Now I'm gonna put my hand here and then put pressure, resist. Amazing. Everything is symmetrical and normal. The next part we will be looking at is the upper limb. Taking a look at Mr. Overton's upper limbs, everything is symmetrical. The skin matches the rest of the color, like the body color. There is no lesions, there is no scars, there is no involuntary muscle movements, and the muscle bulk is the same for both sides. I'm gonna be, the skin looks dry, and then I'm gonna be palpating. Can you please tell me if there is any pain?
Nope.
Amazing. There is no pain or tenderness for Mr. Overton, and the temperature is warm, matches the rest of the body. I'm gonna be checking the trachea as well. It's all normal and fine. The next part, I want you to squeeze my hands, please. Perfect, thank you. The grip is strong and equal for the both sides. And then the next part will be the radial pulse that we will be listening to. I'm gonna be doing 30-second times 2 for the sake of the video. Okay, I'm just gonna get you going with that. And I'm gonna set my timer. Okay. Okay. The beat is 72 beats per minute. It's regular, it's strong, and it's equal on both sides. Moving on to the lower limb here. Taking a look, it's symmetrical, okay? There's no lesions, there's no scars, there's no masses. The skin tone matches the rest. The skin is dry, and the muscle bulk is equal, and there's no deformities. Now I'm gonna be palpating as well. Do you feel any pain? No, there is no pain and no tenderness. There's no joint inflammation, and the temperature is the same as the rest of the body. Okay, and now I'm gonna be moving to the next part, which is I'll do the respiration. No, actually, I'm gonna do your lungs. I'm just gonna get you to move around.
Okay.
Okay, perfect. Now, taking a look at the symmetry, everything is symmetrical. There is no lesions, there is no scars, there is no masses, and the skin color matches the rest of the body. It's dry, and there is no visible palpations. To make sure and double check the symmetry of the lungs, I'm gonna be placing my hands here on the waist, and I'm gonna ask my patient to move, take a deep breath in and out, please. Thank you. So the expansion of the lungs is symmetrical. My next part will be palpating with my palms. So I'm just gonna be touching you here. Perfect. There's no signs of lesions or masses. Also, the temperature is the same, is warm, is the same as the rest of the body here. And now we're gonna be listening for sounds to see if there's any abnormal sounds. Okay. I'm gonna use the diaphragm to listen to the sound. Take a breath for me, please, in and out. Thank you. Another one. 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 Another one, another one, another one, and on the side, and here. Perfect. No sound of bronchi, crackles, or wheezing. It's a vascular breath sound, which is the normal sound that we are looking at. I'm gonna get you to turn around for me now. Thank you very much. Now we're gonna do the respiration rate. I'm gonna be counting for 30 seconds and checking his respiration, okay? Okay, so it's 22 beats per minute, and it's regular. There is no accessory, the rhythm is regular. There is no accessory muscles used. There is no signs of distress, and it's smooth, it's regular. Yeah, that's what I would say about the respiration. Okay, perfect. The next part is that I will be doing the apical heart rate, which is basically the mitral valve. It is located on the left side on the 5th intercostal space. It's mid-clavicular line, okay? And we're gonna be listening to it for 30 seconds times 2, and we'll get the rate. Okay? Just gonna get my watch. Okay, perfect. So that was around 72 beats per minute. I heard the S1 and the S2. There was no signs of S3 and S4. It was a regular rhythm. It was strong, +2. So this is what we have about the mitral heart rate. And the last one will be the abdominal. I'm gonna get you just to lay down for me, please. Thank you very much. Perfect. Taking a look at the patient, the stomach is flat. There's no signs of scars, there's no signs of lesions, there's no signs of masses. The skin color matches the rest, and also the umbilical is midline, so it's symmetrical to the body. Before I palpate, I have to listen to the bowel sounds, because if I palpate, I will make fake bowel sounds, which we don't want to. So we're gonna be starting with right lower quadrant, and we're gonna be listening with the diaphragm, okay? Perfect. It's high pitch, 5 to 30 sounds per minute, I would say. And then there is gurgling sound. So those are all normal signs that we're looking for. The next part will be palpation. And I'm gonna start with the right lower quadrant as well. And I'm going clockwise, just the way I did with the auscultation. So, is there any pain when I do that?
Nope.
Perfect. Amazing. There's no signs of lesions or masses. The temperature matches the rest of the body temperature. There is no visible pulsation. There's no scars. Everything, the finding we had today was normal. That would be the end of head to toe assessment for my patient. And thank you very much.